So tell us the thrust of your findings here, Tracy. Why have statistics around long COVID been distorted? I think the word is distorted. What have you discovered?
Yeah, the main problem has been overestimating how common this problem is and attributing all of the symptoms to the COVID infection itself. A lot of the studies, in the beginning, first of all, we were really looking at the most severe cases of COVID-19 because those were the ones that were being diagnosed. And then we were, reporting the prevalence of how often these would have lasting symptoms and what those were. Okay, but then we weren't including the cases that were mild or had lesser symptoms because we weren't testing those people. And so then it kind of gave this impression to people that, if you got COVID, it was a very high chance of you going on to develop long symptoms. But of course, if you're in the ICU, if you're in the hospital for a long time, it's a long recovery. So in the beginning, we had that kind of, sense you had a very high chance of having long COVID or lasting symptoms of long COVID based on those initial severe cases. And then the problem sort of persisted where we continued to look at people who got a diagnosis and their risk of having lasting symptoms and comparing them to people who, and then failing to compare them to like a control group, and so one of the main problems in our that we uncovered in our research was that a very high percentage of the studies of long COVID basically look at this long list of symptoms among people who have had the diagnosis of COVID, and then they say, how likely is it that these people have these symptoms for 3 months or more, but then they fail to compare them to like a control group. So people who, we're humans, we develop problems, we develop symptoms, we get headaches, we get fatigue, we get anxiety. And so that ended up being probably the biggest problem in the research papers that we were looking at, was they simply didn't have a control group. And probably the best example of this was a study from Norway where they looked at children, and they looked at children who had a diagnosis of COVID-19 versus those who didn't. And they actually checked antibody levels to make sure that they hadn't been infected. And the prevalence of symptoms consistent with long COVID was around 45% in both the children that did and didn't have COVID-19. And there was no significant difference between the two groups. And so then you're thinking, okay, well, now are we calling every symptom after COVID long COVID? And so I thought that study was brilliant, and it gave an example of, both how we're calling everything long COVID that's a symptom after COVID, and how important it is to compare to an uninfected control group to get perspective.
Yeah, it's almost a semantic point that's here, Tracy, that there are people who go to hospital with COVID and have organ damage that could have long-lasting effects on their lives. And people will know there are famous examples of people who have that. That is one definition of long COVID, such a severe damage caused by recognizable COVID that it damages their life potentially forever. Versus people who ask the question a year after having COVID, do you still feel a bit tired or headachy? And they go, yes. And that's long COVID. And so you end up with a term that is so elastic that it covers people who are nearly still dying of the organ damage caused by COVID, which happens very rarely, to people who are attributing mild symptoms to the fact that they once had COVID.
Exactly. So it really, it does a disservice to people who had severe COVID or have actually severe symptoms following COVID, and they're trying to get a treatment or they're trying to figure out what it is. And when we call everything long COVID, because then they just get lumped with all of these people who are misdiagnosed as having long COVID when really what they have is something else. And then we have this other issue of, people are afraid, that they're very afraid of getting COVID because they think their likelihood of getting long COVID is so high. And our US CDC is still saying that 1 in 5 people get long COVID after they have COVID-19 based on, the flawed methodology that we're talking about, where they basically say, did you have a new symptom after COVID-19 and did it last 3
Yeah,
months? But that's any new
yeah.
symptom.
Is
And we also have, people who are going to the doctor with vague symptoms, and the doctor says, well, it's probably long COVID
yeah.
because they're reading these papers, but it's not long COVID at all. It's something else
Is this
that they really should be worked up for and treated for.
is there a psychological thing here then, that long COVID is something of a crutch, both societally and individually, that because we all want to explain away everything, people want to understand things that are sometimes not understandable, people get ill, varieties of illness all the time. To a certain percentage, long COVID becomes a psychological thing as much as a physiological thing.
Yeah, I definitely think so, because when people have symptoms, they, whatever the symptom may be, especially if it's very, it causes pain or it causes, dysfunction, like they want to have a diagnosis, they want to have a label on it. And so they may say, okay, well, I got it after COVID-19. It must be due to COVID-19. And so in that way, people may be latching on to saying that it's that, simply to have a name for what it
Yeah,
is they're suffering from. But I think, my co-authors and I, we really argue that, we need to be more specific about what we do consider long COVID, so that if people are really having lasting symptoms from COVID-19, that we can accurately figure out, like, pathophysiologically, what is it that's going on, so we have a better chance of treating them. So, like, right now, when we talk about how to treat long COVID, and I read the studies, I think, well, what is long COVID? How are they even defining it? And
yeah.
if we don't know what it is, how can we treat it? It makes it very hard to treat when we don't when we don't have a good definition of what it is.
Are you prepared though, Tracy, that long COVID has caused all sorts of high emotions. It has it's part of a culture war, often in terms of how we've responded to COVID, what COVID means. You're going to get a lot of grief for this, Tracy. People are going to say you're denying long COVID, you're taking away their lived experience, one of the awful modern phrases that we now have to live with, which just means experience. But they're going to say all this stuff. They're going to say to you, you're denying the lives of people who've been damaged by long COVID, because actually having long COVID is integral to their sense of self, and you're taking that away from them.
Well, yeah, I guess I would say that being accurate is also synonymous with being compassionate. And so, as a practicing physician myself, I really, work hard with my patients to listen to them, to understand what it is they're suffering from, and to help them get the correct diagnosis. And so one of the reasons I think this research is so important is it shines a light on a problem of overdiagnosis and misdiagnosis of, certain people's true conditions as long COVID, when it's actually something else. And and then on the other hand, I do hope that doing, researchers doing better design studies in the future will help people who truly do have sequelae of COVID get the diagnosis and treatment that will benefit them.